Hi guys, I'm here to tell you how to utilize custom modules in a better way. So custom modules are very important because combining the different subjects in a particular manner can help you integrate all those, and MCQs also you can solve by adding these tags like NEET-PG, AIMS, and by this you can solve previous year questions. Most common is very less asked, but still most common is very important. And clinicals and image based is really important. So because these days image based gross images, cut section images, CT scan images, and these are most commonly asked. So I hope Marrow included many of them after this NEET-PG 2024. So try the image based and clinical. I classified subjects and which are the tags to be added for a particular subject. So coming to subject wise, anatomy is mostly of images. So try solving adding images and PYQs clinical, because images and plus clinical are most commonly asked. Along with that, radiology is also very important. For example, cut section of a cross section of a thorax, pulmonary artery divisions, levels, and identifying the superior vena cava, aorta, ascending aorta, descending aorta in relation to the esophagus. These are most commonly asked. So those are inicet's favorite, I must say. Then coming to the biochemistry also same images. Images are less commonly asked. Biochemistry is all about. They most commonly include molecular biology in specifically for inicet. Molecular biology and vitamins are most commonly asked in inicet. So also in biochemistry, Zellweger syndrome, beta oxidation, and these are most commonly asked. So try solving those. Coming to the pharma, in pharma problems, numbers, drug of choice, and most common. These are the tags to be added in the pharma. Forensic, image-based eponyms like suggelation, putrefaction, and so these are the eponyms. So you have to know each and every eponym in the forensic. And clinical is very less, but still solve clinical. And drug of choice, especially in the toxicology, what are the antidotes? I must say, add this tag and you will get antidotes. In microbiology, image based most common, and clinical microbiology is very important because they don't just ask what is gram positive, what is gram negative, streptococcus, staphylococci. They are gonna give you infective endocarditis, and they're gonna give a case scenario, and finally they're gonna ask which is the microorganism, and in that way they're gonna ask. So include clinical and image based, that will be really helpful. And coming to the short subjects, derma mostly image based and facts also. ENT, ophthalmology, these are instruments very less asked in ENT and ophtha, but still you have a just have a look because no one knows what is going to be asked. So ortho is mostly of image based. Also try including ortho plus radio also. Before we added anatomy plus radio. Also here try solving ortho plus radio. It will be really helpful. Coming to anesthesia, CPR, resuscitation, BLS, these are most commonly asked. Along with that, most of our clinical postings like intubation, cannulas, and what else? Central venous catheter, these are most commonly asked in anesthesia. So, clinicals and instruments, oxygen cylinders are very useful. And inhalational anesthesia, these are very important. So anesthesia also, there are many image based questions and slides in anesthesia. Next, there are some specific, I have included some specific tags like integrated systems. Do not just read medicine, physio, patho, pharma. For integrated systems, do them combined, because in BTR it is integrated systems are in a particular manner, so you can follow that in the last minute revision. For example, taking CVS, include patho, physio, pharma, medicine, peds in the custom module tag and solve, add these tags, do clinical, add these tags, do the drug of choice, image based, slides, most common. Don't combine these, solve them individually while reading your that particular subject. Okay, by this way you can include you can complete all the integrated systems in a specific manner. I think this is the best approach, so try doing this. Next, coming to surgery and OBGY, you can't actually combine them with above subjects, so do them individually. Instruments, image based, slides, clinical, and most common benign tumors, most common malignant tumors, they are not asked commonly, but still, because of this FOMO, so peds and biochemistry is really important, because combining them we have chromosomal disorders, inborn errors of metabolism, Mendelian disorders, autosomal recessive, autosomal dominant. Don't skip these, guys. Put it on your wall, revise daily, because autosomal recessive dominant, X-linked dominant, X-linked recessive are very important. Do not skip this. And coming to the SPM inicet favorite is the biostats. So solve all the questions in the biostats in QBank. Read biostats, go to the QBank, solve everything, and come back to the custom module and solve these numbers, image based questions, problems, everything, because most of the questions in the SPM are biostat. Do not rely on May inicet 2024 exam, because it is not of a particular subject, they have not divided equally. So try solving from 2017, that will be useful, and it will cover almost all the topics of biostatistics. And so this is all about custom modules, because doing custom modules will help you to solve questions in a particular manner, how the questions are being asked. So many people asked how to solve custom modules, so I came up with this. Next, one active recall is equal to 3 passive recalls. So just looking at the notes doesn't make you remember the things. You have to do active recall at least once. I prefer twice if you are if you have a problem with remembering everything. So how to do active recall? Open your notes, hide the notes with your hand, and try to fill the gaps and read whatever it is there. Just make the image based memory, and see again your notes. If you are forgetting, even if you remember 30%, that is enough. Next time try remembering 50%, 70%, because at a time we can't remember everything whatever it is in the notebook. Even if you made your notebook with your own hand, will forget every time. So do this, but the it is time factor. Active recall takes a very long time, even it finally worth it. So do not skip active recall, even if it is not possible doing twice, do it at least once. So active recall is really important. Next, day after tomorrow is Sunday. Try giving a GT. If you have do not given any GT, try giving a GT. Baseline GT, consider it as baseline GT. It is the baseline score of whatever you know until right now. So what to do on GT day? On the day of GT, in the morning, try studying chote copy if you have, or stick notes, volatile topics, formulae. If possible, try just have a look of them and give GT, preferably in the morning, and review it in the afternoon. There are two methods of reviewing a GT. First method is uh, first know what did you do wrong, what are the wrongs, next guesses, next corrects, and review the wrong answers first. Go to the notes and just look at the answer. What is the answer? And complete wrong answers first. Then go to the guesses and then corrects. Corrects, just review the answer. No need to read entire explanation. After that, take out all the mistakes you have done. If your concepts are not good of that particular topic, then learn from mistakes. Go to the notes, study the concept, understand it. If necessary, watch the video too. Then also same for the guesses, learn the concepts. By this way, next time you will be improved by maybe 20 questions or 10 to 20 questions. So this is how we approach GT. Next, reviewing subject wise is also preferred if possible. Either way, you can review GT. Don't think that today I will review 50 questions, tomorrow 50, day after tomorrow 50. Don't do that, because on the day of GT, you will remember what is the question and options. Every question, you will remember 200 questions. Day by day, you will forget everything and you don't know where you are going wrong. So do not do this mistake. Even I have done so many times, but don't do this. Review the GT in the same day. If your rank in NEET PG is 1 lakh or above that, is it possible to crack inicet? This is the most common question, guys. Uh, I won't say that you will get AR 10 or AR 20, but it is possible to get 2000 or 1000 if you do it in a proper way. Compared to May inicet, November inicet is on the easier side, maybe. Also, the competition is very less, so try it. Maybe it is possible. Even if you get 100,000 or 2000 rank, it is a very big achievement. So do not think that my rank is 1 lakh, I'm a mid ranker or I'm a below average student, I won't be able to crack inicet. Do not destroy your entire preparation with your negative thoughts. Don't give yourself a tag of 1 lakh rank, because it is not gonna stay. Ultimately, you are gonna get 1000, 2000, 10, 20, whatever. This rank is gonna be your ultimate rank. So this is how to approach GT's active recall and custom modules, guys. And lastly, I want to say one thing. Small disciplines repeated with consistency every day lead to great achievements gained slowly over time. So, Zainab ma'am told us that baby steps, studying daily, consistently, not giving up, or doing MCQs every day will boost our marks. I really followed that. So, I really hope you follow this, and consistency is the key. There is no other than this. So thank you so much, guys. Please feel free to ask doubts in the comment section. Thank you so much.